Ollier disease is a rare, non-cancerous condition where many small cartilage growths called enchondromas form inside the bones. These growths develop mostly in children and can appear in the hands, feet, arms, or legs. Think of the bones as a wall made of bricks. Ollier disease adds soft extra bricks inside the wall, making it weaker in spots. The exact cause is still unknown, but scientists have found that most people with Ollier disease have tiny changes, mutations, in the IDH1 or IDH2 genes that happen after birth, not something they inherit from parents. It is like a typo that appears in a book after it is printed. It is not in the original manuscript, the DNA you get from your parents, but shows up later in some cells. Typical signs include small painless bumps under the skin, especially on fingers or toes, bones that feel weaker and may break easily, even with a mild bump like a toy falling on a hand, uneven growth of limbs, causing one arm or leg to look longer or bent, occasionally mild pain, if an enchondroma presses on nearby nerves or joints. Imagine a child who notices a lump on a finger that never hurts, but later the finger bends strangely. That could be Ollier disease. Doctors diagnose Ollier disease using X-rays to see the dark spots and enchondromas inside bones, sometimes followed by MRI for clearer detail, and rarely a small tissue sample biopsy to confirm it is not cancer. Treatment focuses on monitoring and fixing problems. Regular X-ray checkups every 6 to 12 months. Surgery to remove an enchondroma that is causing pain, fracture, or deformity. Orthopedic procedures like bone rods or braces to straighten a crooked limb. Close watch for any sign that a benign growth turns malignant cancer, which happens in a small number of cases. There is no known way to stop Ollier disease from starting because the gene changes happen spontaneously. The best prevention is early detection and regular monitoring so that any trouble is caught early. Simple steps include seeing a doctor if a child has unexplained bone bumps or frequent fractures, avoiding heavy impacts to affected limbs. For example, protect the arm with a soft pad during sports. Keeping up with scheduled X-ray follow-ups as advised by the doctor. Recent research has focused on the IDH1/IDH2 gene mutations. Scientists are testing drugs that block the abnormal protein made by these mutated genes, hoping to stop enchondromas from growing. In addition, 3D printing technology is being used to create exact bone models for surgeons, making it easier to plan precise removal of problematic growths. While these advances are still in early trials, they offer hope for safer surgeries and possibly medicine that targets the root cause in the future.